This week, we're learning more about Black maternal health. Black women are 3 times more likely to die from a pregnancy-related cause than white women. So let's get right to UofL Health's Dr. Tiffany Thomas-May with maternal fetal health. Let's start with some of the causes of these pregnancy-related deaths.
Hi, yes, and unfortunately, a lot of the causes are very preventable, and high blood pressure is one of the biggest things that we are seeing. So women that either aren't taking their medication for blood pressure disorders or aren't even aware of their blood pressure disorders is one of the biggest causes that we're seeing.
And what are some of the things that you should be keeping in mind right now when it comes to prevention before you get to that spot?
So one of my favorite things to tell patients is you should go into pregnancy being the best version of yourself. So that means getting in the best shape of yourself, making sure you're taking care of any medical problems that you have. And a lot of us don't like to take medicine, but these are things that are going to make your pregnancy much healthier and decrease some of your risk.
And now let's talk a little bit more about why we see those higher death rates with Black women.
Unfortunately, a lot of it is some of the bias that we see in medicine, and some of that is just location. If we even think about the city of Louisville, where the hospital is located, they're not convenient to a lot of our patients. So a lot of hospitals in the area are trying to disperse out and be closer to these patients, whether it's the clinic, the hospital setting. So I think that's one of the biggest things, and education. Unfortunately, we're not the best advocates for ourselves, so all of our patients should never be afraid to advocate for their own health and to make sure they're being heard by their doctor if they have any fears.
And what are some of the ways you feel like UofL Health is really doing a great job reaching these patients?
One of the reasons that I joined UofL is because they prioritize education of our physicians, our students, our patients. They allow for the time during my clinical appointments to actually spend time with patients, make sure they understand what's going on in the disorder. I don't want anybody to leave my office feeling rushed at any point in time during their pregnancy. And so I think that's one of the best things a hospital system can do.
Yeah, that's really important, really special. Well, thank you for taking the time to come on and talk about this today. We really appreciate it.
Thank you for having me.